The Centers for Medicare and Medicaid Services, or CMS, has been actively fighting the opioid epidemic by increasing access to evidence-based treatment for opioid use disorder, or OUD. One of the ways the agency has done this is by expanding Medicare coverage to Opioid Treatment Programs, or OTPs, that deliver medication-assisted treatment to people suffering from OUD. With this expanded coverage, Medicare allows OTPs to enroll in and bill for these services. In this video, we'll discuss the services and requirements for submitting claims to Medicare as an OTP provider. After you've enrolled as an OTP, there are specific codes you can bill. These codes allow for a bundled payment for OUD treatment services, which includes dispensing and administration of medication-assisted treatment medications, substance use counseling, individual and group therapy, toxicology testing, intake activities, and periodic assessments. You must furnish at least one of the services during the week to bill for the bundled services. These codes for bundled services are allowed once for a 7 contiguous day period. To bill for these services, CMS created HCPCS codes. Enrolled OTPs are the only providers that can bill for these services. If you enrolled using the CMS 855A, then your services are billed to Part A. Part A is known as the hospital insurance and provides coverage for facility services. If you enrolled using the CMS 855B, then your services are billed to Part B. Part B is known as the medical insurance and provides coverage for services provided by physicians, non-physician practitioners, and suppliers. It's important to remember that billing is different for Part A and Part B claims. Now let's review the billing for each, starting with Part A. Under Part A, there are specific elements you must include on your claim in addition to the OTP HCPCS code. First are the type of bill codes. Freestanding, non-residential OTPs bill type of bill 87X, and hospital-based OTPs bill type of bill 13X or 85X. Second is the condition code 89. Hospital-based OTPs must include this condition code to communicate that they are billing for OTP services. And last are revenue codes. This includes 90X, 91X, or 949 for OTP services. You should also include revenue code 0636 when you need to report drugs. The revenue code 0636 also requires a HCPCS code to be submitted with it. Now let's talk about Part B billing. Just like Part A, there are specific elements you must also include on your claim. First, you must report the prescribing or medication ordering physician or other eligible professional's NPI. This information is reported in the ordering referring field of the claim. Second, you must report the NPI of the billing provider, which is the OTP. This information is reported in the billing provider field of the claim. Third is the diagnosis code. Make sure to report the most appropriate code to represent each patient's diagnosis or nature of illness or injury. Remember that the diagnosis must be coded to the highest level of specificity. And last is the place of service code. The place of service code 58 was established specifically for OTPs billing under Part B. Now that you know the basic elements to include on your claims, let's talk about some common claim submission errors that we're seeing. These errors relate to patient eligibility, provider eligibility, and billing the appropriate date of service and units. We'll review each one to help you prevent your claims from denying or returning as unprocessable, which means you have to correct the claim and resubmit it. Let's start with patient eligibility. You should check your patient eligibility prior to rendering services and submitting your claim. Checking patient eligibility includes looking at the effective date of the patient's overall Medicare entitlement, as well as checking to see if they have other primary insurance coverage, making Medicare secondary, or if they have signed up for a Medicare Part C plan, also known as Medicare Advantage. Checking a patient's eligibility is very easy and can be done through our interactive voice response or IVR system, or online using our free internet portal, Spot. You can find more information for Spot and checking eligibility in the video description below. If you rendered the services prior to the patient's entitlement date, the services will not be covered. Also, if the patient has Medicare as secondary insurance, then the claim must be submitted to the other primary insurance prior to being submitted to Medicare. And if the patient has a Medicare Advantage plan, then the claim must be submitted to that insurer instead of a traditional Medicare. The next common error is provider eligibility. The OTP must be enrolled with Medicare to render and bill services to the program. When a Medicare contractor such as us approves the OTP enrollment application, we also assign an effective date, which is included on your approval letter. If claims are submitted with dates of service prior to that effective date, the claim will not be paid since the provider is not eligible. And finally, we often see errors with the billing of dates of service and units. The codes established for OTP billing represent a weekly bundle of services, with the requirement that at least one service is provided during that week. Even though the codes represent a weekly bundle, you only bill one date of service and one unit of service. If you bill more than one for the weekly bundle codes, the claim will not be paid. Okay, so you learned the basics of billing for OTP services and the claim submission errors to avoid. Let's review those key takeaways. Claim requirements are different for Part A and Part B. You must determine who you are billing to know what elements to include on your claim. Check the patient and provider eligibility before submitting claims. This will ensure you submit your claim to the appropriate insurer for the date of service. And last, bill only one date of service and one unit for the bundle code, since the code represents the entire week of services that have been provided to that patient. Keeping these guidelines in mind will help you submit claims correctly the first time and prevent unnecessary denials or rejected claims. We hope you learned what you need for submitting claims as an OTP with Medicare. You can find more information and resources in the video description below. Also, don't forget to subscribe to our YouTube channel to access more of our educational videos. And thanks for watching.